Good afternoon. My name is Martin Baucom. I'm Vice President of Development for the UNC Health Foundation. Welcome to all of you and thanks for joining us today. The UNC Health Foundation has for the last couple of years organized a series of events that are focused on the impact of the research and care that is conducted and provided here through UNC Health and the School of Medicine. We look in particular at ways that philanthropy has forged that impact. So early on in the pandemic, we transitioned these events to a virtual setting, and we've been really pleased with the rate of participation among our supporters and others who are interested in the work that we do. So again, I want to thank you all for taking the time to join us for the day's session on mental health during the COVID-19 pandemic. This really continues to be an era that's filled with uncertainty and some fear and certainly new stresses for everyone across our society. So I know there's intense interest in today's subject matter. And some of those stresses are particularly true, I think, for people who are first responders and healthcare workers, or those who were already being treated for mental health issues. So we're excited to talk to you today about some of the resources that are available here at UNC Health, as well as an innovative and very unique new program called the Heroes Health Initiative. I'd also like to thank the many of you who, again, have been generous in supporting the integration of research and care here at UNC Health, and specifically those of you who have given recently to our efforts to respond to the COVID-19 crisis. We've raised a little more than $1.8 million so far to advance those efforts. Much of that funding has gone to support both patient care and then the unique support needs that we have for our frontline healthcare workers, the folks who may not be able to stay at home, even if the rest of their families are. So before we begin, I do want to remind you that we want to encourage question asking during this program. And to ask a question, use the Q&A feature that's located at the bottom of your screen. And we encourage you to ask those questions. Check the box to ask anonymously so that we can protect everybody's identity. I'd now like to commence the real program for today, and I'm very pleased to introduce our first two speakers. First off, we'll hear from Dr. Cristy Page. Dr. Page is Executive Dean of the UNC School of Medicine and was named to that position in February of 2019. So she's had a lot to deal with in her short tenure in the job. Prior to this position, she was chair of our terrific and highly ranked Department of Family Medicine. Dr. Page is a lifelong Tar Heel. She received her undergraduate degree from UNC as a Moorhead Scholar, and then later received both her MD and Master's in Public Health from UNC before completing her residency here as well. And then she'll kick it over to Dr. Samantha Meltzer-Brody, who's chair of the Department of Psychiatry and is the Asad Mamandi Distinguished Professor of Psychiatry. Dr. Meltzer-Brody also directs the UNC Center for Women's Mood Disorders and leads the UNC Health WellBeing initiative. She is an internationally recognized physician scientist. There's, again, that research-informed care that we provide in perinatal depression. And in 2020, she received the Omax Gardner Award from the UNC system. Those of us who have been at this university or any other across the UNC system know that that's the highest faculty honor that the university system can bestow upon any faculty member across any of its 17 campuses. So a great couple of first speakers, and I'd like to hand it off to Dr. Page.
Great, thank you so much, and good afternoon to everyone. We are so grateful for your participation with us today and for your ongoing support of our mission. We're very lucky to have two great colleagues in Dr. Samantha Meltzer-Brody that you just heard about, and also Dr. Sam McLean, who have joined us today. I think everyone will learn a lot from their updates, and I just want to thank them for their hard work on behalf of the School of Medicine and UNC Health. I did want to just provide a brief update of where we find ourselves now with COVID-19 across UNC Health. We were originally anticipating our peak of cases coming in mid-September, but currently our models are looking a little bit better, predicting that we might have hit our peak a little earlier. But that, although it's good news, it all depends on what happens next, and that depends on all of us. We've seen in recent weeks the clusters and outbreaks in our college campuses that show us that the virus is still very active. in our communities. And so we really want to continue wearing our masks and observing physical distancing and washing our hands and doing all the things that we can do on our part to continue to get through this and get on the other side of this virus. Our research teams and our physician scientists continue to do remarkable work. And right now we have several clinical trials underway for a potential vaccine and for effective treatments that might prevent serious illness and keep patients out of the hospital. So we do feel like there's some room for optimism, and that's something that's, hard to find these days. So it's a good thing, but we do also know that the virus will be with us for the foreseeable future. And that is why today's conversation is so important. Our coworkers at UNC Health are just working under great stress and have been for several months. They've stepped in to put caring for patients as primary, but they're also worrying about their own health and keeping their families safe. And on top of that, we've had many difficult and deep personal conversations about race and structural racism. People are worried also for their spouses and their loved ones, possibly losing their jobs and the impact that would have on their families. Parents across the system are balancing all of those things and coming to work while also trying to make their children successful in virtual learning and sorting out childcare and elder care needs. And so this can be, of course, overwhelming and certainly exhausting. So we've worked very hard to develop comprehensive and easy to access resources that people can use when they need support. And it's both your speakers today, as you hear from Samantha and Sam, they've just done a great job of making these tools available and communicating to people so that people know how to access them. So it's a high priority for us to focus on the well-being of our coworkers as we take care of our people in order to take care of our patients. So I'm really excited for the rest of today's discussion, and I'll go ahead and turn it over to Dr. Samantha Meltzer-Brody.
Thank you, Dr. Page, and it's a pleasure and honor to be here today with all of you. Wanted to share some thoughts as the chair of psychiatry at UNC on what we've been doing to respond to the crisis that we're facing. And wanted to share about the UNC WellBeing Program. UNC Health started this originally in 2018, and it's been something that we have needed to markedly ramp up. You could say we've had to put it on steroids to meet the needs of the pandemic. And it's been a real pleasure and honor to be able to partner with Sam McLean and his team to be able to try and come up with many different ways to meet the emotional health and well-being needs of our colleagues. Next slide. So one thing that is pretty clear is that the mental health of the general population is suffering during the COVID-19 pandemic. There's new CDC data that came out showing that 2 in 5 US adults are having with clinically significant mental health or substance use issues. For younger adults, for racial ethnic minorities, and those with pre-existing psychiatric conditions, they are suffering the most. This is a crisis, and the markedly increased prevalence of anxiety, depression, and worsening of other mental health and substance use disorders is staggering. Next slide. All of these things really impact our workforce as well. So it's the general population, but it's also our workforce. And COVID's crushing mental health toll on healthcare workers is well documented, including increased risk of suicide. And this is something that weighs heavily on me, weighs heavily on all of us, and is something we've been trying very, very hard to get in front of in a very short period of time. So I'm incredibly appreciative of the support from Dr. Cristy Page, Wesley Burks, the Health Foundation, and those who are helping to support these efforts. Next slide. So the WellBeing Program at UNC has been doing a number of things. I want to highlight those things that we have built and launched quickly over the course of the pandemic since March. This is widespread stress first aid training, which is a way of helping our frontline healthcare workers and others to have learn emotional tools and skills on how to cope during this trying time. Stress first aid comes out of the military and out of other first responders like firefighters. It's something that there's an evidence base, is easy to teach and deploy, and has been very, very helpful. And we took multiple faculty in the Department of Psychiatry and had them start training broadly. We've offered a number of free support groups to our UNC Health workforce. This is anyone at all in the workforce, whether you work in nutrition services or janitorial services, or you're a physician or nurse. These are all run by faculty, psychologists or psychiatrists on a variety of topics. Anyone can join for free, and they've been widely attended. And in fact, the number of people attending keeps going up, and we've had at times literally hundreds who have signed up to attend these free support groups. We've also done a number of webinars, and so this is a webinar. It's very nice for people to be able to join virtually and listen to a topic on different mental health topics that are of interest, and really trying to give people tools and skills to help navigate this very difficult time. In addition, outpatient psychiatry, we've been very, very busy. We are about 140% of our pre-COVID volume, largely with the same number of faculty, which gives you a sense of how hard people are working and trying to respond to the increased demand for services. We are also doing a lot to look at how we support people with a focus on racial justice. We're tracking how people are doing. The WellBeing Index is something we've used the last few years, and doing any number of things. Due to the COVID-19 philanthropy funding, I want to highlight that we've been able to launch a Healing Heroes helpline. The H3 line is available, staffed by trained mental health support providers, social workers, and this has been a very busy and important line that partners very nicely with the Healing Heroes app that Dr. McLean will be talking about later. But this has been a wonderful partnership and something that I think has been a great resource. Anyone can call this across the organization. Next slide. And the other thing we've done is we've tried to take all the complicated array of services and make a roadmap. This is a roadmap that is being widely disseminated that lets people know how to call, how to get an appointment, where they can access things. In its live version, you can click on all of these things as a link and let people know how to do this. As a, you know, you're looking at it now and obviously cannot click on it. But for immediate support, there's a phone number to call that goes to our helpline, our website. And so what we've really tried to do is come up with an array of services. Just to give you a sense of what we're dealing with, there's widespread anxiety and depression. There are people who are struggling with grief related to any number of things. Someone can have a family member die. They're not able to be there with them often at the end. Funeral arrangements are often very curtailed. So it's extremely difficult when people are going through challenging times to have to do it while being socially distanced. That goes against everything that we are as human beings and becomes an enormous challenge. All of this can increase social isolation. We are finding that our youth are particularly at risk. Many of our elderly can be at risk, and everyone in between. And so lives go on. They go on for all of us in our workforce. And yet our frontline healthcare providers, those of us working, have to contend with other people in our lives and the challenges we're facing. So we are trying to think very holistically about how we take care of the population and the patients we serve and take care of our workforce. Next slide. And so just want to give, for more information, if you're listening and you're interested in knowing, how do I seek care? Whether I'm grieving or having panic attacks, or my child is manifesting symptoms that are worrisome to me, or whatever it may be, this is how you can contact us in psychiatry, and we are certainly happy to talk about what we're doing. Today actually is World Suicide Awareness Day, Suicide Prevention Day. We are all very humbled by how much research is needed to help understand and develop novel treatments for mental illness, whether that be schizophrenia, bipolar disorder, depression, PTSD, and that there is an ongoing need for us to enhance the way we deliver to care and develop novel treatments. So we thank you for your support of our work and happy to share additional information.
Sorry, I had to unmute there. Thank you, Dr. Meltzer-Brody. That was highly informative and a terrific presentation. We appreciate it very much. I'd like to encourage you all again to ask questions using the Q&A feature located below. We have a couple already that were pre-submitted that we can get things started with. Dr. Meltzer-Brody, one of our participants today asked what they might do to get an adult family member, someone with a history of mental illness, seen by a psychiatrist at UNC. What are the steps to take?
Well, we've tried to make it as simple as possible. Almost all of our outpatient appointments are virtual, which allows people to have an appointment wherever they are in their home. And there's a number to call and get scheduled. So we are trying to get people in as quickly as we can, but we certainly want people to be seen sooner rather than later if they're having symptoms that have been persistent or troubling. So it should be a phone call away to get scheduled. That's right on our website, the web information I gave at the end for outpatient psychiatry and the phone number for scheduling.
Terrific. Okay, another question. I am single and living by myself. Are there any tips or resources you might provide to make sure that I'm taking care of my mental health?
It's a great question. I think that when people are spending a much more substantial time alone, they can start feeling extremely lonely and socially isolated. So one of the most important things is that we're recommending everyone start being very intentional about how they're connecting with others. That can be virtually, that can be asking people to take socially distanced walks or get together outside. We are human beings, are social beings. We are social creatures. We absolutely have to have social connection. We are not meant to be in isolation. And so if you are, it becomes, for a length of time, it becomes really at severe detriment to your mental health. So connecting with friends and family and doing that virtually, or better yet, figuring out how to do it safely in person and being very intentional about that. Figuring out ways you can get out and do things that are safe. And I think that we are fortunate, certainly in North Carolina, to have fairly nice weather most of the time that permits us to be doing that. So really encouraging people to do that, figuring out what you can do to make sure you're getting exercise. So people being stuck inside and looking at a screen all the time becomes really isolating. The last thing is to really mitigate and watch the amount of social media consumption or news consumption, because there's good data showing that that can be overwhelming too. And lastly, just to watch what people are doing in terms of self-medicating with alcohol or other things. So we know alcohol sales were up 60% during the lockdown. We also know that the use of opioids is markedly increasing as people are trying to cope with current events. And so really wanting people to be focused on what are healthy and constructive ways of coping versus not, but reaching out for supports. That can be many different ways. It can be your spiritual supports, it can be family, friends, whatever it may be, but really making that a priority.
Great. Here's one for those of us who are parents. My child is doing virtual learning. What are ideas to make sure I'm protecting their mental health and maybe my own as a parent too?
Well, I think all of us can probably have strong opinions about that. I'll offer one thing and then open up to others. You know, no one really wanted to go to, as someone described, Zoom kindergarten. This is really abnormal, and it goes against what we need for socialization for our children. And yet, at the same time, we have to keep kids and families safe. So it's a matter of having to figure out how to navigate with choices that none of us want to be making. I think you have to make sure your child is being able to do things that kids do, which is interact with others, get outside, even though they're going to be having much more time if they're doing learning virtually, looking at screens. It's really vital they have time away from screens and that they're able to do things that kids do and run around and play and be creative. really watching how your child is sleeping, making sure they're getting good nutrition, asking them about how they're doing. Now, kids aren't going to share things in the same way, but if you see more irritability, aggressiveness, disrupted sleep, more tearfulness, our kids are having a hard time and figuring out ways where they can connect with nature, with family, with friends, as best as possible is critical. So make sure you're monitoring their social media use as well, and especially for younger kids, trying to shelter them from just the barrage of sort of news that can be overwhelming, and importantly, giving them hope that we will get on the other side of this. It's really important for kids to hear that.
Great. Thank you for that answer. We did have a question about what resources might be available for a person older in age who is dealing with grief over the loss of a longtime loved one.
Well, grief is one of the things that brings many people into getting psychotherapy or mental health support. There are people that their entire career is focused on helping people with grief. So there's grief counselors. There are licensed grief counselors either through clergy, for if people want to seek out a clergy member that is consistent with their religious views, or someone who is not a faith-based clergy member or mental health provider. In the Department of Psychiatry, we have many therapists that help people address grief and grieving. I would say it's incredibly important that people honor the need to grieve and they respect the journey through grief, and that they access resources that speak to them. There are grief support groups. Most of them are virtually in the community that can be found online. So I would definitely encourage that anyone going through that not to grieve in isolation. In fact, all cultures and all forms of organized religion, grief and how we support each other always requires a community response. And you see that, over the millennium and around the world. And so we do not want anyone to be grieving alone during this time. It's just a terrible place to be, and seeking ways to get support is vital.
There was also a question seeking clarification about an earlier part of the presentation. Did you say that UNC offers mental health or COVID-specific support groups?
So the COVID-specific support groups at UNC are right now focused on our workforce and managing COVID. However, it's a great question because we are getting ready to offer COVID-specific groups for the general population who have been impacted by COVID, either personally or with a family member. So that's something we're going to be rolling out, and we're going to be offering more forms of group psychotherapy to the general population. So that's something that we hope to be launching actually over the next few weeks.
That's great, terrific. And if there are no other questions, and I don't think there are, I'd like to hand things off to my great colleague, Margaret Carroll, who will talk a little bit about Dr. McLean's program. And so Margaret, take it away.
Remember to unmute myself. So, hi everyone. I'm so pleased to be a part of this conversation today and be a part of this wonderful group of people that are doing the best to give advice to people in this really challenging time for mental health and for all sorts of things. I'm so pleased to be able to introduce to you my colleague and friend, Sam McLean, a physician and vice chair of research in the Department of Anesthesiology at Carolina, as well as a ER attending physician, where Sam has seen firsthand the effects of COVID on not only the healthcare workers, but patients, and has experienced it himself, along with most of his family and pet. So he can provide us with an incredibly interesting take on all that's going on, but most importantly, he can share with us a very timely project that he's created called Heroes Health. It's an initiative that provides mental health services via app, which was graciously created for Carolina by our friends at Google, free of charge, and has been supported by so many terrific corporations as well as individuals and foundations. A couple of those are Bank of America, our friends at One Mind, which we have one of the the One Mind, the president, Brandon Staglin, on this call, and we're very pleased about that, as well as Rockefeller Foundation, as well as DRK Foundation, and numerous individuals who have found this to be a way to feel good about how they can help people during these challenging times. So with that, I will turn it over to the expert, Dr. Sam McLean.
Thanks so much, Mary Margaret. And it's a real pleasure to be here and get a chance to tell you a little bit about the Heroes Health program. I've been so fortunate to be able to partner with One Mind, a really fantastic leading mental health foundation, and we've worked together on a number of initiatives. They've been fantastic partners with UNC and with our wonderful tech partners at Google. I thought I would take, as Mary Margaret alluded to, just a few minutes to talk a little bit about what led to this initiative. And that was really my experience at Carolina. I think Carolina is such a special place, and we have such a wonderful sense of community. And I really view this as really a testament to that in terms of how people came together to create this app and this program. I think that working at Carolina early on in the pandemic, in March, as we started to get a lot of COVID cases, really was a unique experience for me in my 30 years in medicine, in that the challenges were really unparalleled. And I count myself fortunate in that I'm a frontline COVID worker, but am not personally and do not live with anyone who is particularly vulnerable to the potential effects of COVID because of a pre-existing illness or challenge that they faced in their life. But I have many, many colleagues who do, and I have for example, a wonderful nurse friend of mine who lives down the street and works with me at UNC, has a son, has two sons, one with special needs, which makes him particularly vulnerable to COVID. And so she, to be able to continue working as a nurse at UNC, had to move her kids out of the house to a friend's house and live for many weeks by herself, and just visit her children in a socially distanced, very difficult, intermittent way, to be able to still dedicate herself to taking care of patients with COVID who are coming into UNC. I have another friend, Josh, who's a nurse who works with me in the emergency department, who is a type 1 diabetic, and just wouldn't think twice about, or didn't think twice about, still coming to work and taking care of our COVID patients, but speaks very openly about the additional challenges that he faces as a father of a very young son, and he has his own responsibilities outside work. It's really important for him to, of course, maintain his health, and it's an extra risk and challenge for him to be able to take care of folks. So working in our ER COVID unit in March, I was seeing a lot of stresses because of anxieties about getting sick oneself, or again, as I've said, sort of even more getting a loved one sick who was vulnerable. And then we were seeing a lot of really upsetting cases, a lot of sadness, and it was just a really heavy toll. And I remember, for example, when the first patient came in that I personally cared for that tested positive for COVID, I was working with a nurse, and we'd seen a number of patients that we thought had COVID, but this was the first one that the test came back while we were still in the emergency department taking care of this individual. And the nurse just looked at me and she said, "I just need a second to go sit down," because it sort of all hit her how she was now directly exposed to COVID and what that meant for her, and how she needed to change her life to protect her family, and how she was going to have to do things differently at home. This is a different nurse than the one I alluded to earlier. Just a lot going on. And I remember specifically seeing a nurse who was crying, just sitting at her desk, and just had been sort of temporarily or for the moment was feeling a little overwhelmed. I can't remember honestly even about what. I think it was about everything. And so it was just kind of crying quietly to herself. And I thought, here's this challenge again with this virus where it separates us all. And she's coming in, changing her clothes, coming and working a 12-hour shift, going and taking a shower at the hospital, going home and taking another shower, and then has very little time to interact with anyone. And does anyone else in the community have a chance to understand what she's going to or reach out to her? And that's really where sort of the thought about creating the Heroes Health program, which is an app-based program to help communities support COVID workers, sort of came from. And but again, it would not have happened without a huge community effort at UNC, without our fantastic tech partners, and then without tremendous support from really, I'll view One Mind as our frequent partner in efforts to help with serving these types of missions, or going on these types of missions. So, but I contacted folks at Google, who I had a chance to work with in my research job, and they were really wonderful, particularly at Google's moonshot company, Google X, which is in charge of creating all of their cutting edge tech. And one of their leaders said, "We're on board, we're going to do this with you." And they got dozens of people to work on creating the app, and created the app within only several months. We also had loads of people from Dr. Page's office. Our dean, who was on the call earlier, she was wonderful, as were many folks in our office, to help figure out how to make this work. Loads of people from across University of North Carolina Technology Services, so many folks, again, dozens of folks working on this at UNC to get this launched. And then of course, One Mind, which provided philanthropic support, and then a lot of expertise, because they are really leaders in One Mind, in supporting mental health initiatives, and just know so many folks in the field. So we got this program up and running in early July. What does the program do? Well, basically it's an app, the Heroes Health app, that one can download from either the Google Play Store or the App Store. And downloading it, healthcare workers can download it to their phone, any healthcare worker in the United States, and it'll provide a basic weekly assessment, allow people to track their mental health over time, and then connect them to resources, critical resources. But we really look, and we really hope to leverage the program by partnering with specific organizations, either EMS or first responder organizations, or healthcare systems or hospitals. And that by partnering, what we can do is that we can provide a local number to folks to call, to link up with, like the wonderful program that Dr. Meltzer-Brody, who's really a national leader in mental health for healthcare workers. UNC is really a center of excellence for supportive workers. Link into all of the supports that her team provides. But very importantly, in addition to listing their program as a number, what we allow people to do when they download the app is choose to confidentially share their weekly report results with a mental health specialist or mental health provider confidentially at UNC. So really at UNC, one of Dr. Samantha Meltzer-Brody's team, or we have healthcare organizations across the US that have signed up for the program. So at each of those organizations, whether Indiana University in Indianapolis, or Jefferson in Philadelphia, or Cooper in New Jersey, there's a mental health team or a person that they link up to. Then when someone gets those reports, or the mental health worker gets the reports of workers, they can reach out and contact people who are experiencing severe symptoms, or indeed even thoughts of self-harm. We have hundreds of people who've signed up for the program, getting towards 1,000, and we've made I think almost 100 outreaches, for example, to people who are expressing thoughts of self-harm, and to be able to connect those people up to services. And so lots of different outreaches to people who are really in the most dire circumstances with their mental health and experiencing thoughts of self-harm, or people who are experiencing severe anxiety and depression, or people who are even experiencing moderate symptoms that we want to help with their sleep, or different recommendations about how they can take care of themselves. And just reach out, and a connection and an offer of thanks and support. We've made so many of those contacts through the program. We also are continuing to improve the program, and are working to do things like we have several proposals that we're working up to test what app is best for what particular person, mental health support app, as a way to improve what we do. And also we're reaching out to try to help other communities using this tool, whether that be different types of college athletes or professional athletes, or college students, or there's different communities, the education community, teachers, and what they're facing. So it's really been a wonderful experience for me, and I've gotten to know so many people at UNC through developing this that I didn't know before. And then I think it's been just a fantastic partnership through the UNC Health Foundation, the support that they've been able to help link us to through Mary Margaret, who really is truly outstanding and helping us to do these types of work through One Mind, and then again through Google, who's been a really terrific partner, and I know really looks to UNC to partner with in these types of efforts. So I hope that, Mary Margaret always knows I tend to chatter on, but I hope, Mary Margaret, that wasn't too much, but it's, again, I get excited about this program and talking about it, so.
Well, I think you get everyone excited about this program when you speak about it. So it's okay with you. I have a couple of questions, and I know we have some questions coming in from our community on the call. So my first question is, what are the biggest challenges facing COVID-19 workers today, and how have those challenges changed from what you saw beginning in March?
That's a great question. Yeah, I think that the experience of the pandemic has, in some ways, I think there have been kind of two changes that have happened since March. One is that things are always scariest that we haven't experienced. So the conception of how bad it was going to be to be experiencing the wave of COVID patients coming to the UNC and the UNC health system, at least for me, and I think for many healthcare workers, just like many of us in America, seeing the images coming out of China and really being braced, and then hearing that it was coming. I think that once you get into it and start working with patients and kind of get down, working with the personal protective equipment and learning how to deal with that, I think that there's some of those anxieties as you just get into it go down a little bit, as with many things. Then I think on the other hand, there is just the grind of, there's the initial days and you kind of get over that and things get a little less anxious and a little less stressful. And then as it goes on, there's sort of this grind that we're all experiencing, but we experience at the hospital where just more patients struggling to breathe in front of you, and it just doesn't seem to end. And I think that's been an additional challenge. So I would say it's both gotten easier in some ways and gotten harder in many ways. And I think the main challenges are those I really alluded to, the personal, the fear of personally getting sick, or even not being able to support your family, not being able to be there for them. I developed COVID in March after working in the unit for a few weeks, and then happens about 2 out of every 5 times someone transmits COVID, they do so before they develop symptoms themselves. So I infected 2 out of my 3 family members, besides myself. I infected before I even knew I was sick. And so 3 out of my 4 family members, my son and my 20-year-old son and my wife, both were ill with COVID, and then we were all sick together at the same time. So, I think there's always that anxiety of giving that to a loved one, particularly again, if you have a loved one that's vulnerable. And I have many, just like we all do, many friends who have loved ones who may be getting cancer treatment, maybe be on immunosuppression for another type of illness. And for them, it's really a particular stress. So all of those types of things. And then just again, the difficulties of seeing patients struggling, it's very hard.
I can only imagine. I will say one of the things that's rewarding about working with you, Sam, is that you do a lot of things that are of the moment and you're able to make them happen quickly. As you mentioned, Google hitting the ground running for us and getting this app done in a very short 3 months. I guess my question is, with regard to the app, how are you seeing it used? Is it used being in other places rather than just North Carolina, or is that to come? And what is the data telling you about the people using the app?
Yeah, it's a great question. So I think that currently we're launched at UNC and at Cooper Hospital in New Jersey, and we either are already launched or are launching, today, tomorrow at Jefferson Hospital and the Jefferson sort of hospital system in the Philadelphia area. And we are pending launch at Indiana University, at a few EMS systems, And honestly, I think it's about 10 more places that if anybody's seen this who's affiliated with any of the places we're launching, and forgive me, so we're launching it at a number of different places around the United States, which we're excited about. How we're seeing the app used is, I think, where we're really seeing it used in these sorts of early days is we see that people who are struggling are most likely to download and use the app, and which is great. And that's something that we didn't know initially. So would people use the app who were experiencing distress? What we find is that in general, our experience to date suggests that when we email out the app to, information about the app to say an intensive care unit and all their staff, a lot of the people who sign up to use the app are experiencing substantial symptoms and are people that we can reach out to and connect to services. So I think people are using it as a way to get linked up with support, which is really wonderful to see. And again, we're continuing to try to refine it. We know that there are ways that we can make it better. And one way that I mentioned is by not just offering resources, but by recommending to people a particular app. There's I think more than 20,000 apps out there. And as my colleagues at OneMind know, and Brandon knows, a huge issue is trying to identify what are the best apps and which ones are, frankly, kind of charlatan, trying to make a buck apps, and which are really high quality apps that are designed not to take anybody's money, but really to serve humanity. And so they have a cyber guide tool that they have developed at OneMind, and that there are leading experts who review apps and figure out which ones are the best. But even among the best ones, there's maybe a dozen that are recommended of different types of treatment. So we're trying to do studies to figure out, if I log on tomorrow and I fill out my initial survey, can you tell from that initial survey what's going to work best for me? Is it going to be this type of treatment or that type of treatment? Can we develop a tool that would allow us to match the best treatment with the best individual? And or say, oh, this person is someone who really needs a therapy with an individual, a human and not an app-based intervention. And so that's another component that we're adding into Heroes Health and working to get off the ground. So I think we're in the early days, but I'm thrilled that we've been able to reach out to so many people who were really considering even self-harm and get them into care. So I'm really gratified that we've been able to do that.
Well, Sam, thank you again for joining us today and sharing this information. While sobering, I know that the community at large is grateful for your work here and your excellence at Carolina and helping us to stand out to do what we can at this time for others. At this point, I'd like to pivot to our guest, Brandon Staglin, who is the president of OneMind, a fantastic nonprofit based on the West Coast in Napa that provides mental health resources such as brainwaves and podcasts and different venues for people to listen to and learn about what's the newest thing going on in mental health and actually find some solace in what they might be feeling during this time. So with that, I'll turn it over to our good friend, Brandon Staglin.
Thank you very much, Mary, and thank you, Sam, for your profiling of the Heroes Health app and for all the work that you do. I'm Brandon Staglin, and as a schizophrenia survivor and president of OneMind, I stand for healing. I'm living proof that with loving family support, science-based medical care delivered early, and community involvement to build agency, one can recover from even the most serious, debilitating, and sometimes deadly of mental health challenges. I'm very proud to work with scientists like Sam McLean through my work at OneMind. And these world-class scientists are doing work to help patients better their lives. And I really love the work that I do and the life that I live, but it wasn't always like this. When I was diagnosed with schizophrenia at age 18 in 1990, the delusions I experienced were harrowing and terrifying. I was convinced that there were demons lurking behind every corner, behind every bush and tree, waiting to pounce on me if I made the slightest little mistake, like stepping on a pavement crack or eating too much food at a meal. And the constant pressure I put on myself not to make a mistake like this and be dragged off to hell was tiring me out terribly, and I was beginning to despair after a couple of months of this constant pressure. And I nearly decided to take my own life. I'm very grateful to be alive and happy to be with you today. Now, there are two things that got me through that very dark time: curiosity and love. I was studying chimpanzees as a volunteer research assistant that summer of 1990, and I still never seen one perform one of the spectacular dominance displays, this behavior that they do, as I read about in Jane Goodall's books. And it occurred to me then that as I was lying there in the dark, considering dying, that if I stayed alive, I could see one of these someday, and by extension that the world held endless potential for beautiful discoveries, and that I could make these discoveries happen. So I got up and moved on. Now, the love of my family was equally important. When I got depressed in the days following that, they were unconditionally there for me no matter what. And their love sustained me, even when I couldn't feel it back for them. I knew that I wanted to feel that love and participate in the love of my family again and get past my illness so that I could do that. So I could dedicate myself to my recovery, taking my medication, lifestyle changes, and it worked. But the experiences that I had during that time of recovery have been instrumental in teaching me core values of faith in the integrity of science like Sam does at UNC, science like other one-minded scientists do to help patients, and the potential for science to help patients. Also, the primacy of love to give meaning to life. And these two values inform and guide my work and my life today. One Line was founded in 1995, inspired by my family's shared experience, founded by my family, and inspired by our shared experience with my diagnosis and recovery from schizophrenia. And our mission today is to accelerate collaborative research and advocacy to enable all individuals experiencing brain health conditions to build healthy and productive lives. In that work, we are tackling the brain health crisis, this immense challenge that's getting even more pronounced as the COVID crisis continues. And we are approaching this challenge through a three-stage strategy of accelerating science and discoveries through collaborative research, getting these discoveries to patients through continuously learning networks of care programs, and then informing society and educating the public about the hope inherent in these discoveries. And these three stages of our strategy cycle back on themselves to spiral patient care and empowerment ever upward. So in this work that we do, we're very proud and grateful for the opportunity to work with great scientists around the world, scientists like Sam. Sam's an exemplary scientist leader. Not only is he extraordinarily caring, as you heard about just now, for his patients that he cares for and the people that his research aims to help, he's also an extraordinary analytic and creative thinker, and he never shrinks from a challenge. I really admire that about Sam. He never gives up no matter what. And the programs that we support that Sam leads are the Aurora study, which is one of the largest study of post-traumatic stress ever undertaken. It's already discovered over 100 biomarkers. These biological measures can help determine who's at risk and then how treatments can be developed for these individuals. And then also, of course, the Heroes Health app, which you just heard about from Sam. Sam, thank you for the work that you and your team do there at UNC and all across the United States and your Aurora partnership and the Heroes Health partnerships that you make. Really proud and excited to support you in your work. Thanks so much.
Thank you, Brandon. It's one of the great honors of my life to work with your family, and you know I love you, buddy.
Likewise, Sam.
Brandon, would you mind answering just a couple of questions?
No, that's fine, please.
Okay. Could you please speak on mental health patients with a daily lifestyle of isolation, no social connections, and how COVID compounds their life right now?
Yes, I can speak to that. So during my second episode of schizophrenia in the mid-1990s, I lived by myself in San Francisco to be close to a psychiatrist to be treated. So I wasn't living with my family at the time, I was living in an apartment alone. And my social skills were not very good at the time. The illness had made me decrease my social function, and I wasn't comfortable making new friends. So I spent most of my time alone, either walking around the streets or playing computer games at home, reading if I could pay attention that long, which was difficult for me then. It wasn't good for my mental health. And I learned firsthand then about that fact that, as Samantha, Dr. Meltzer-Brody said earlier, we are social creatures, and that's a fundamental truth. I think it's really important, and as I found then, for people to reach out and make connections if they don't have them. So what I did back at that time, back in the 1990s, was I spent more time with my family. I was able to see them on regular occasions and build up my social abilities by interacting with them and the people that they knew. And that practice helped me, along with some cognitive training, to get more comfortable meeting people and making friends socially, and that helped me to ultimately make more social connections, which has helped me immensely in the years that have followed. So that's one tactic that somebody who is socially isolated and experiencing mental health challenges can use. Spend time with your family. They care about you, and I believe that that's something that can be very helpful.
Okay, just one more. I recall that exercise is very important to you. Can you tell how that's made these times a little bit more easy to bear?
Absolutely, yeah. Ever since I was a teenager, I've exercised every morning, and never without fail do I miss it. I need that to be on an even keel throughout the day, and to stay focused as well, and it elevates my mood. So I urge anyone who is feeling anxious or listless to try exercising. It really can have a pronounced effect. And the scientists that I've worked with over the years, Sophia Vinogradov at University of Minnesota currently, she has done a study that shows that regular aerobic exercise, and others have done this too, regular aerobic exercise is good for releasing this hormone in the brain called BDNF, which builds new brain connections in your brain, right? And so it improves your mental health and your brain health that way. It's not just something that people experience, but it's actually shown in the brain to do that. So exercise is a hugely beneficial thing for mental health.
Okay, well, thank you for sharing a very personal and courageous story with our online community today. We greatly appreciate it. To that point, we are going to put up some slides with some resources that you can use for yourself, or quite possibly, if you find it appropriate, share with some of your friends who may be looking for some information to help them through these times as well. You'll note here we show several of our UNC Health resources. These slides will be up for a while, by the way, after we close out, but these are our UNC Health resources. And then we have some additional national helplines, and of course we have highlighted OneMind here at the top because we know first and foremost that's an excellent choice. So I would say that today's conversation has been incredibly helpful to hopefully everyone that took the time to call in, and it is recorded. We can get it to you if you didn't have the chance to hear the whole thing. I do want to point out that you can Google OneMind, you can Google Sam McLean, you can see Sam talking about the Heroes Health Program on the Today Show and on Fox News and on different venues if you want to go back and listen to that again. And you can always reach out to your friends here at UNC Health Foundation, because our objective has always been to care, not about the programs that we support, but the people that help us support them and those who may need something in the future. So with that being said, I'm going to wrap up and let you guys take a look at the slides at the end, but I want to say thank you very much, and I hope that we see you again, maybe face-to-face or maybe virtually. Thank you so much.
Thank you, Mary Margaret. Thank you,
Yeah.
Brandon.
Thank you.
Thanks, everybody.
Thank you.